vaccine help?
16 different kinds of cancers are treated with this vaccine, plus solid tumors. Among them will be lung cancer.
What exactly does this vaccine do?
The vaccine is intended to arrest the growth of the cancer as well as eradicate it if possible. That we're not sure of yet, but that's part of the design of the trial.
What are the investigators trying to determine?
The investigative part of the study is to determine whether or not there are side effects of any significance by the vaccine. And in addition to that, how effective the vaccine will be in eradicating the cancer.
What is the vaccine called?
The medical terminology for the trial is autologous vaccine, commonly called tag vaccine.
What is the vaccine made of?
The vaccine is made of the patient's own tissue. They either take a biopsy of the tissue, or if there's surgery involved, they take some of the cancer and use that individual's DNA to identify to the cells in the individual's body, the immune fighting cells, that particular cancer. And those cells then have an identity like a fingerprint that allows them to go to the cancer cells, identify them, and eliminate them, providing, of course, the vaccine is successful.
How do you feel about the vaccine?
I'm very optimistic about the vaccine. I've known about the Mary Crowley work for a number of years. I have the CEO, David Shanahan, and Dr. John Neminitis are both friends and clients of mine. So I have a personal acquaintance with the people over there, and that gives me an added confidence. I respect and admire their abilities so much, and feel like that this study is destined to be a leading edge and successful result.
Could you describe the procedure?
The procedure for this particular vaccine is that the individuals that participate in the trial have to have undergone conventional treatment. This is normally radiation, chemotherapy, sometimes surgery. And if those conventional treatments have failed and the cancer recurs, then they're eligible to be participants in the trial. The trial is approved by the Federal Drug Administration in the hopes that it will provide a new effective treatment for conventional use for people in the future.
How long will you be in this study?
Normally the period for the trial is a 12-month period. Vaccine is induced once a month by shot in the arm. And in my particular case, they're just going to do a 7-month treatment period.
Are there any side effects?
So far, there have been very few side effects obvious with this vaccine. Typical ones are pain in the arm where the shot's administered. It's kind of like a flu shot. Or in some cases, a little rash around where the shot's administered, itching, that sort of thing, but nothing at all that's significant.
Can this vaccine cure lung cancer too?
It is hoped that this vaccine will be successful in treating multiple types of cancer. Among them will be lung, breast, head and neck, several different types of cancer. Again, it's a trial, but Mary Crowley Cancer Research Center is among the very finest in the country. We are fortunate to have it right here in Dallas, and they do an excellent job in researching the treatments and providing this type of specialized treatment for those of us that might be in need of it.